Well, we've heard a lot in the last few days about the immediate medical crisis. What about the impact around mental health, about living through something like this? Well, Dr. Sunil Mittal is a psychiatrist based in the capital, Delhi. He joins us live on the programme. Thank you so much for being with us. It is an absolutely terrifying backdrop. We know that in terms of psychologically what it is doing to people, what is your assessment? What have you seen?
Thank you for having me here. And yes, the pandemic is currently the way it's raging through the country. It's a devastation, and then of course it takes its mental health toll too, because the direct impact of people having suffered, people the sort of fear, the anxiety that they have of either contracting the disease or their loved ones dying or their family members suffering, the dismay, and of course a huge amount of frustration which people are feeling at this moment of time when they really don't know what's next.
As you're speaking, we're showing pictures from the hospital. You'll have seen them. We've seen so much of that in the last few weeks. The funeral pyres as well there in Delhi. People will be watching that. I've heard of people barricading themselves in their homes, too scared to perhaps even go out to get a jab, a vaccination. What are you seeing and hearing?
Well, yes, there are sort of different sorts of reactions people have had. There are people in absolute strict quarantine, like you said, almost barricading themselves inside their houses, fearful to step out, and it's a digital world, so they get their supplies. People haven't really taken well to the vaccine. We have a large vaccination drive, and almost, I believe that the number of vaccines which have been administered are in millions. It's like we are doing millions in a day. We're doing a few 100,000 a day. But at the same time, there are people who have let their guard down. They've been out. They had, if I can say, a risk compensation after their vaccination, or when they felt that the pandemic was sort of, it was plateauing out, the curve was flattening out. People there were festivals, there were celebrations, there were political rallies, and then, of course, religious congregations. Huge, and that became super spreader events.
And we've seen those pictures from today around the elections and the amount of people turning out. So different people are obviously reacting differently. I know you've been looking a lot at the mental health of healthcare workers, because they're on the front line and they're having to absorb so much, as well as taking personal risks.
Well, yes, and so we've been working with healthcare workers, doctors, nurses, or other frontline workers like the police and other volunteers too. And the mixed emotions. One, of course, is this huge call to duty, and people, they're exhausted, they're working non-stop, the hospitals are working non-stop, but then in private they come and break down. They have never seen so much of death. And doctors and medical personnel feeling that I can save this life and I just cannot because of lack of equipment or oxygen or basic equipment. Well, it's so stretched out because the healthcare system can take only as much. It can't take beyond. And we're a large population with a large amount of sick number of people today. And yes, in this, there is anger and frustration too, because we have failed to really invest into healthcare over the last many decades, which we ought to have done. And perhaps there is hope that there's going to be learning from this.
Just a final quick thought about children, because only in the last few days here in the UK, we've obviously been focusing on mental health issues in that particular age range, but also we had a report about the impact it's having even on language skills of the very young.
Yes, one of course is what children are full of energy. They need to be out. So they've been confined during the pandemic. They've seen the quarrels at home, children in small apartments, small or multiple layered buildings, and then, of course, distance learning, which is not the same as going to school. Language has suffered in children. Children have witnessed domestic violence. Children have witnessed, indulgent parents, and children have missed out on their peers. And I think if you look at a country like India, where the digital reach doesn't reach every child.
Yeah.
The loss of education, the loss of learning is going to be more than a year. And that's a large amount of, effort which has gone in to step up the learning, but it's not happening. And yes, and children, young children, they can't make sense out of death and the fear, anxiety they see in their family and parents. When they see their parents or their grandparents, we live in extended family units, suffering, and the anxiety is writ large, and they really can't understand. For them to make sense out of death, for them to make sense out of a pandemic is difficult. Yet, we know that children are resilient. And Indian society has been resilient.
Yes.
We have coped with the worst of disasters. And I see some hope there that people at this moment are standing together in solidarity. And you have volunteer agencies, you have religious agencies which have come forward to supply oxygen, food,
Yes.
Medicines, mobilizing resources, community resources are being mobilized. And that's a lot of hope which exists despite all the anger and frustration and the dismay that one can see.
Well, Doctor, I hope you're right. Dr. Mittal, we have to leave it there, but thank you so much for joining us live on the programme there from Delhi. Thanks so much for your time.
Thank you, Matthew.